Flu activity is still elevated in California, so much so that a local medical center has set up tents outside to hold the waiting flu patients.
CBS 13's Yasmin Hassan is looking into what doctors in our area are seeing. Yasmin.
Tony and Sharon, the doctors we spoke to say for months on end, every single day, they've seen at least 20 patients with the flu. I mean, let me get out of the way. You can see how packed this Kaiser parking lot is. But what's most worrisome, doctors say, is that it doesn't seem to be slowing down.
It's like every other patient that walks in, oh, that person's got the flu, that person's got the flu, and it's just been steady.
According to the California Department of Public Health, there have been 325 flu-related deaths since September 30th, 2018. 16 of those in Sacramento County.
Most of them are under 65, so they're mostly adults who didn't get immunized and often have a chronic condition, a chronic respiratory condition.
In the last few weeks, a second strain of the virus has also started spreading. The flu is hitting so many people, Kaiser Permanente Roseville Medical Center has a tent set up outside. It's being used as a waiting area to accommodate the surge in patients, something that doctors say is safe.
It's probably a good idea to stay warm anyway, but you don't get the flu from just being in a cold environment.
The hospital is also bringing in additional resources, including physician consultants, nurses, and transport, lab and radiology services to expedite triaging and care. It just takes one person to get sick, and it can spread from there.
We want to have as many people immunized as possible. Not only do they get prevented from having the condition, but they can prevent it from spreading it to their families or the workplaces of their parents.
Doctors say flu season usually lasts through April, so it's not too late to get vaccinated. But if you do get sick, seeing a doctor right away is the best and really only option, because the medications are only effective for about the first 48 hours.
If you're doing okay and it's been several days, there's really not much that can be done for the flu as far as treatment.
Here's another example of just how bad this flu season is. One of the doctors that we tried to interview today said that he just didn't have any time because everyone in his clinic had called in sick because of the flu, and he was just the only one there left.
Yeah, I believe it. But again, not too late to get vaccinated. Yasmin, thank you. So if you already got the flu this season, are you in the clear or can you get it again? Well, we looked into this. Well, at the beginning of the season, most cases of influenza were due to influenza H1N1. However, over the past few weeks, there's been an increase in the identification of influenza H3N2. It is not uncommon for a second influenza virus to emerge later in the season and cause ongoing disease.